The contents and information contained within this video is solely for educational purposes only, and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider, or another qualified medical professional, with any questions or concerns you may have regarding a medical condition. Never disregard professional medical advice, or delay seeking advice as a result of content viewed in the video.
Hello everyone, welcome to my YouTube channel. I am Ransom Anyema and I am a radiologist, medical student, and also medical writer all the way from Nigeria. So today I am joined by Surayyah Aziz. She's a pharmacy medical student from the United Kingdom and has a keen interest in oncology and nuclear medicine. Surayyah also participates in physics research and is currently being published in a Harvard journal for her recent astrophysics project. She is passionate about the interface of physics and engineering with medical science and clinical advancement. Today, I will discuss all things cancer with her and how she sees the future of oncology developing as research and discoveries advance in coming years. So quick questions here. Why does cancer care interest you as a pharmacist?
So cancer care involves the prevention, diagnosis, treatment and management of cancer. So it's a really interesting and broad field. And I believe that pharmacists are really integral to this team of members that deal with cancer care. So what we'd call in the healthcare profession a multidisciplinary team or an MDT. So when it comes to cancer care, otherwise known as oncology, we're able to bring our specialist knowledge in when it comes to medication, drug interactions, patient education, to support and optimize patients' treatment, as well as enhancing the overall quality of care. And I'm sure you know as a radiology student that this is really important to not just focus on the medication side of things and maybe the patient's illness, but also how they're feeling about it as well and the quality of life as they're being treated.
Thank you so much for that answer. I do agree 100%. Pharmacists are crucial in helping medical doctors, such as radiologists and other medical professionals, in ensuring all patients are cared for accurately and safely. Are there any key areas you would identify where pharmacists specifically can bring in the medication knowledge with regards to oncology?
Okay, so yeah, that's a really interesting question. So I'd say pharmacists play a crucial role in several areas. For me, the main ones would be medication management, adverse effects management, drug interactions, compounding and IV administration. So don't worry in the audience if you don't know what these mean yet, we will elaborate. Patient education, supportive care, and I think the last one for me would be clinical.
Thank you for that. Could you possibly explain each of those areas so our viewers and audiences can get a deeper insight into what these involved?
Yeah, sure, Ransom. So with medication management, pharmacists are experts in medications and their proper use. And I'm sure you'll agree that in cancer care, patients often require complex medication regimens, including chemotherapy drugs, targeted therapies, and supportive medications. So pharmacists are basically in charge of helping to ensure the safe and effective use of these medications, by verifying prescriptions, reviewing drug interactions, and providing dosing recommendations, amongst a whole load of other things. We also educate patients on how to take the medication correctly and warn them against any potential side effects and how these can be managed. On the second note of cancer treatments, these can have significant side effects ranging from nausea and fatigue to more severe complications, as I'm sure you'll have seen in your medical training as you've gone along. So in terms of adverse effects management, pharmacists work close within the MDTs we mentioned earlier or multidisciplinary teams to identify and manage these adverse effects. So we provide guidance on medications to alleviate symptoms and improve the patient's quality of life during treatment. On this point of patients' quality of life, cancer patients can often receive many medications, multiple medications, including those for managing comorbidities. So those are conditions that exist alongside the cancer, or medications prescribed by different specialists. So especially when you're in a team of different healthcare professionals, um, depending on what they see and assess, they may prescribe different medications. The pharmacist basically works here to help identify any potential drug interactions. Maybe the two healthcare specialists didn't have the time to communicate between each other. To see what other medications the patient was on. It's a pharmacist's job to check all of them, see any potential interactions, as well as any side effects, and assess those overall risks, and to minimize them then by adjusting doses, changing medications, and as well as prescribing, we deprescribe, so we take off medications as well. Another interesting area that people may not know of is compounding and IV admixtures.
All right. Can you quickly define admixtures for our Surayyah before we move on?
Yeah, definitely. So admixtures are the products we get when we mix two or more preparations. Usually these are parenteral, meaning then the medications are not delivered orally. So for example, we might deliver them intravenously, so that's via vein, so an injection if you'd see that, or any other sort of route that's not oral. And this is to meet the individual patient's therapeutic needs. So the process is complex and it has to be done with great care. We usually do it in hospital labs, so you'll see hospital pharmacists taking part in this. And we must mitigate the various risks that arise by ensuring the environment in which we prepare these admixtures, so to speak, are safe and aseptic. And aseptic just basically means germ-free.
Thank you, Syria. Now that you have cleared that up for the audience, do you mind if we can finish the remaining areas in which pharmacists bring their expertise into cancer care?
Yeah. So we left off on compounding and IV mixtures. So here, some cancer medications need to be prepared in specific dosages or formulations. Pharmacists with expertise in compounding can prepare customized medications, such as the IV admixtures we talked about earlier, or oral liquid formulations to meet individual patient needs. We ensure accurate compounding, sterility, or in otherwise a germ-free environment, stability of the preparations, as I mentioned previously. As well as this, pharmacists also play a crucial role in educating cancer patients about the medication treatment plans and self-care practices. So this is really important because when we're thinking about patient-centered care, we don't want to just be bombarding almost like patients with a trillion medications and they don't even know why they're taking them or what the medications are, what they're doing to the body. It's like if you went to the shop and you were to pick up food off the shelf, if you didn't know what that food was going to do to your body, there's no way you're going to pick that food off the shelf and eat it. And likewise, we don't want to be giving patients medications when they don't know what those medications are going to do to their body. So we will explain the purpose of each medication, potential side effects, and proper administration techniques. We also provide counseling on adherence to treatment regimens, and we offer support for medication-related concerns or questions. However, we must always remember that cancer care and any other health care for that matter extends beyond the targeted therapies and chemotherapy specifically for cancer. Patients may require supportive care medications such as pain management drugs, antiemetics, these are drugs which stop those nausea side effects and the vomiting, or medications to address other treatment-related complications. We contribute to the selection, monitoring, and adjustment of all these medications, as I said before, optimizing that patient comfort and well-being. On a last note, I would say that we play a major role in oncological clinical trials where we evaluate new cancer treatments or medication regimens. We collaborate with healthcare teams to ensure appropriate drug utilization, monitor patient responses in these trials, and assess safety and efficacy outcomes.
Thank you, Sierra. This has been really interesting, right? I must say, particularly given that there are also so many different types of medications that cancer patients can have, and yet they have to be selected and administered so carefully to minimize side effects to patients, maximize safety, comfort, and patient care maintenance. It is also worth mentioning that pharmacists play a key role in educating patients with both pharmacological and non-pharmacological treatments, so that is both medication wise and lifestyle and diet wise too. This is really useful in multidisciplinary team, as messages can be reinforced across healthcare staff and patients can truly feel, be cared for. Now that we have discussed the pharmacy side of things, as my specialization is medicine and particularly radiology, I wanted to ask you how you see the field of oncology advancing in the next 10 to 12 years. Let's say 10 to 20 years. As we know, the field of oncology is rapidly advancing, and there are several key developments which are expected to shape cancer in the next 10 to 20 years globally. All right, so can you possibly provide us with a general outlook on some of these, maybe top five based on current trends and patterns?
Yeah, of course, Ransom. So that's a really interesting question, and especially because my interest is in oncology and nuclear medicine, I do a lot of reading up on this. So there are quite a few different options that I can go through. But before I do, it's important to note that the future of oncology, and like any other medical field, is constantly changing and evolving as ongoing research and scientific discoveries take place. So now that we have said that, I think here are my top five potential advancements. So number one on my list, precision medicine and personalized therapies. So precision medicine involves tailoring cancer treatments based on patients' unique genetic profile, tumor characteristics, and other individual factors. Advances in genomics, molecular diagnostics, and biomarker identification are facilitating the development of targeted therapies and immunotherapies. So these treatments aim to improve effectiveness while we minimize the side effects by focusing on specific molecular targets that harness the body's immune system. And we link these closely with precision medicine in another thing called next generation sequencing, or NGS. So for any viewers who don't know what this is, don't be daunted as I'll explain it now. NGS is a sequencing technology that allows rapid and comprehensive analysis, allowing of patients' genomic profile, and this basically allows us as healthcare professionals to identify any genetic mutations in the patient's body and any alterations which can cause cancers. So as we know, cancers are caused by those genetic alterations. So if we can almost see the genetic sequence before it even occurs or whilst it's occurring, it's much more likely that we can then come and stop the cancer a lot sooner. When we integrate NGS, or next generation sequencing, into clinical practice, we can gain insights into personalized treatment options, identify potential therapeutic targets, and participate in those precision medicine initiatives which I mentioned earlier. Okay, so on to number two. Number two for me would be immunotherapy and immune checkpoint inhibitors. So immunotherapy has revolutionized cancer treatment in recent years. As this trend is very likely to continue. So if we think about immune checkpoint inhibitors, for example, such as PD-1 and CTLA-4 inhibitors. These have shown remarkable success in treating various cancer types. And as research continues, those in the medical field, such as ourselves, hope that this will expand the use of immunotherapies, develop new targets, and improve response rates by combining different immunotherapeutic agents or combining them with other treatment modalities. So number 3 on my list is a more specific one, and it's known as CAR T-cell therapy. This literally stands for chimeric antigen receptor, hence the term CAR T-cell therapy, and it's a promising approach in which a patient's own immune cells are genetically modified to recognize and destroy cancer cells. So in regards to CAR T-cell therapy, it's really been a remarkable new system in its efficacy in certain blood cancers, and it is now currently being investigated for solid tumors. So when we think about current research, it's focusing on improving CAR T-cell therapy safety and expanding the application to different cancers, and then addressing challenges that we sort of see in the pharmaceutical industry, such as manufacturing and accessibility. Number four would be liquid biopsies for me. Liquid biopsies and then the subsequent early detection of cancers. So for anyone who doesn't know what liquid biopsies are, they basically involve the analysis of circulating tumor DNA. This is what we call in the sort of biological sciences as ctDNA, or other biomarkers that are present in a patient's blood sample. So this approach enables non-invasive monitoring of tumor genetics, treatment responses, and disease progression. So by non-invasive, we mean there's no scary surgeons going in with scalpels, sort of cutting you open. It is literally just the very slightest prick of a needle, and we can extract blood, and it's as simple as a very basic blood test then. In the future, liquid biopsies may play a significant role in early cancer detection, identifying minimal residual disease, and guiding personalized treatment decisions. Okay, so now number 5 on my list. Number 5 is what I would count as the much anticipated one, and the one that a lot of people would have said to me, why did you mention this first? Because in today's day and age, everyone's sort of screaming and raving about this one. So I can literally feel the audience screaming at me for not mentioning this one earlier. But I promise it's now here. So what is number 5, I hear you ask? Well, of course, it wouldn't have gone and said artificial intelligence or AI and big data analytics. So here, the increasing availability of large data sets, coupled with advances in AI, like we're seeing sort of in the public realm, such as ChatGPT, but even more behind the scenes in medical sciences, in medical professions, in universities, we have a lot of other technologies that aren't as well known in the public eye. These advances in AI and machine learning could hold great potential for oncology. So AI algorithms can analyze complex medical data, including patient records, imaging, genomic data, to identify patterns, predict treatment outcomes, and assist in clinical decision-making. AI-powered tools may even aid in precision medicine, treatment planning, radiology, which is your area, radiology interpretation, and patient risk assessment. So if we look wider, because obviously sometimes it can feel as though these kind of scarier, if you like, technologies, these complex technologies, AI and data analytics, sometimes it feels like it may only be accessible to one more highly trained medical professionals, such as doctors and surgeons and so on, and maybe people who are like maybe in a more richer, more complex healthcare system, more developed countries. But actually, if you think about it, when this does take off, and if it is used correctly, we can really incorporate this in multidisciplinary teams all over the world. They can appreciate AI by collaborating with data scientists and researchers, utilizing AI-powered tools for risk prediction, for example, treatment selection, and staying informed about evolving AI applications in cancer care. So there's so much potential for anyone and everyone with an interest and a desire to get involved, really. So now I can really see you thinking there, Ransom.
Yes, I am sure. I'm so wild right now. Well, that's very interesting. And sometimes the possibility of AI can seem quite doubting. Not least to medical professionals. It does really affect medical professionals. However, I do think that healthcare will never exist without the human touch in patient care centered care and supporting others. The human connection is really important in terms of patient centered care and also supporting all the people. Thank you for taking us through that again. You know, it was really insightful and nicely broken down into the different emerging development that we can see in this healthcare space. While we are talking about the future of oncology, I think it is worth noting to our audience that these advancements will require extensive research, regulatory approvals, and adequate healthcare infrastructure to translate into widespread clinical practice. However, with the continuous advancement of technology, increasing collaborations, and growing knowledge, the future of oncology appears promising in terms of improved outcomes and personalized approaches to cancer care. How do you think this, Surayyah, how do you think this improvement in cancer care will impact wider oncology in the future or create a ripple effect as we speak right now?
Yeah, Ransom, this is a really interesting question, like all your questions. And this one again has so many different possibilities. So, as for now, this for me will be mainly a twofold question. So, one end, we have the element of supportive care and survivorship. That's definitely something that's going to be advancing. And on the other hand, I definitely say global access to cancer care. So I'm going to explain these two things. Firstly, as cancer treatments improve, more patients hopefully will be surviving as we start having more precise and effective treatments. And so now the focus will shift to being able to support the cancer patients' care as they survive. So, in my opinion, the efforts of medical professionals and healthcare as a whole will be directed towards managing the more longer term related effects, optimizing their care plans as the patients survive longer, and providing psychological support, addressing the overall well being of cancer survivors. Secondly, there's a growing recognition of the need to improve access of cancer quality worldwide. So here I'm thinking, having those facilities that are available in more developed countries such as the USA and UK, and bringing them to lesser developed countries such as those in South Asia, Africa, South America. We really want to have this health equity and accessibility. So current efforts are being made to bridge the gap between developed and developing countries by increasing awareness, improving early detection programs, and enhancing infrastructure and promoting collaborations between healthcare institutions globally. When these enhanced systems are further developed and securely in place, I'm sure you can see that the effort will hopefully and ultimately shift, not entirely, but somewhat away from specific therapies and more towards overall patient care and quality of life, and reducing those barriers to cancer care accessibility across the globe.
Again, thank you for that, sir. And absolutely agree that these two aspects, are very important. And hopefully, once we can become ever closer to achieving as cancer therapists develop down the years. Lastly, sir, before we wrap up, you know, our podcast, I wanted to ask you a question a very doubting question regarding something that has really sparked up my interest as a radiologist medical student. There are several emerging medical technologies in cancer care that have the potential to transform diagnosis, treatment, and patient outcomes. Now, here we go. In healthcare, it is so important that we remain informed about the latest advancements. I was wondering, as well as the advancement you had taken us through before you talked about it, which were very significant ones. Could you possibly talk to us about the significance of advancing imaging techniques and robotic surgery and also potential telemedicine as well, as I see these is a big one when you're talking about like the current trends and innovations in medical communities.
And you took biology or physics, you may have come across some elements of medical physics, which is really this where this area of medical imaging really comes into play. So medical physics is an amazing field, by the way, and this overlaps with the physics with healthcare, and it's just fantastic. It's always constantly evolving and advancing. So, with this said, novel imaging technologies such as positron emission tomography or PET, magnetic resonance imaging or MRI for our audience, and molecular imaging, just to name a few, provide detailed anatomical and functional information about tumors. So, this is really specifically looking at the application in oncology. Cancer care teams will effectively work to adopt these techniques. They will leverage them for accurate staging, treatment planning, monitoring responses, and detecting disease recurrence. So the possibilities are really endless here, and we really do see these technologies being tried and tested all the time. But also, they are in full use in certain stages of cancer care process, and it really is just about getting their use more together, if you like, across all the stages and to all people. So again, that global access to healthcare. Next, we mentioned robotic assisted surgery. Again, another amazing area, allows for enhanced precision, dexterity, visualization during surgical procedures, especially when it comes to oncology and tumor surgery. Many members of the MDT or multidisciplinary team can come together to collaborate with surgeons skilled in robotic techniques, optimize patient selection for robotic surgery, and utilize technology to advance surgical outcomes. So here we're thinking minimizing invasiveness and enhancing recovery. Finally, telemedicine again. This allows for telemedicine and remote monitoring technologies, meaning that healthcare providers can remotely monitor patients and deliver their care, supportive care, and providing consultations really from absolutely anywhere. The multidisciplinary team can appreciate these again by incorporating telemedicine into follow-up care, optimizing remote monitoring strategies, and utilizing teleconsultations. And these provide with a really comprehensive care tool for patients, especially when they're in remote areas. And it's really important when considering patient-centered care. A lot of people may not want to remain in hospital for long times. Maybe it's tiring. Maybe it even becomes traumatic for them. So be given this option to stay at home with your loved ones, but then also have this care delivered remotely, as and where possible, is really, really, truly a game changer. So a bit like how we both are now able to conduct this interview from completely different areas of the globe, it's absolutely revolutionary.
Being able to conduct this interview so easily is, absolutely amazing, Sarah, because you're very, a busy person and busy with work and also busy with, school and everything. And it's has been a pleasure to talk to you today. And in terms of what we have just mentioned, emerging medical technologies are not only for doctors and pharmacists. Everyone in the multidisciplinary healthcare can also foster collaborations, right? Engage in continuous education and trainings. As a medical student, as a medical professional, you ought to read, ought to be educated, you ought to undergo some trainings, and also participate in researches and clinical rotations or trials, and establish effective communication channels so that they are too up to date with these technologies. Yeah, so as a medical student or as a pharmacist or as a medical, whatever profession you are in medical fields, you need to know the up to date technologies, invented or trained. You also need to attend some regular team meetings, case discussions, and knowledge sharing platforms such as this YouTube channel, my YouTube channel, can also help ensure that team members can stay informed and collectively evaluate the potential benefits and challenges associated with these technologies in the context of patient care. Well, I guess with that, we have come to an end for this section. I hope our viewers have found it useful. It has been longer than usual, but definitely worth getting your insights. So yeah, so do well to subscribe, like, and share, comment, and tell me what you think about all this. Thank you so much. Bye.